Thanks so much, everyone, for staying with us on the program. Let's now get our conversation to the politics of healthcare in Nigeria. Resident doctors said they would down tools from the 10th of August, which they call a total nationwide strike looming. He said if outstanding demands are not met, they're saying that they're demanding payment of salary, promotion, comments, and professional allowance arrears. They've called for implementation of outstanding agreements with the federal government. They're seeking improved welfare, better hospital infrastructure, and enhanced patient safety. I'm now being joined by the president of the Nigerian Association of Resident Doctors, Dr. Mohammed Suleiman, who is live for us here in Abuja. So many thanks.
Thank you for having me. Good evening to our viewers.
Thank you so much. Let's begin. Resident doctors have given the federal government until the 10th of August. That's just about 11 days to this time to address your demands or face a total nationwide strike. Why have you concluded that industrial action is now the only language government will respond to despite ongoing engagements?
It's unfortunate that we have arrived at this point. The National Executive Council looked at the whole issues in totality. I can tell you from when we suspended our strike on the 29th of November last year, we had continuously been engaging government. We were to resume that strike as at 12th of January, we shifted it. We were to resume it again at 29th of January, we shifted it. It was to be resumed by the end of February and April, we kept shifting it. As at our May OGM, at the end of May, we gave another 3 weeks ultimatum while these discussions were ongoing. At the expiration of that 3 weeks ultimatum, we shifted it by another 4 weeks. And now, Sheun, we are here with very, very valid and vital issues. What are those most important issues?
So would you say, just before you get into
yes,
that,
please,
that federal government has not been sincere? Because if you're shifting the goalposts, that's what it looks like, what you have described.
The National Executive Council is only concerned about results. Whatever the intention is, we should solve problems.
So they've moved the timelines about twice now?
Have been 4 times.
4 times.
4 times in the last 7 months.
And these are agreements that dated back to how many years now?
Some of them, like the professional allowance table you were just talking about, was supposed to be corrected since 2019. It was not. It was corrected last year. And federal government asked for the arrears not to count from 2019. It counted, I think, from June or July of 2024. So there's an 18 months arrears that is currently not being talked about.
Mm. Your communique, which was in Gombe that you sat, isn't it?
Yes.
It listed unpaid comments arrears, 19 months of professional allowance arrears, salary arrears, promotional arrears, and unresolved welfare issues. Which of these is the real tipping point? And can the government realistically resolve them within the deadline just 10 days?
Realistically, Sheun, in the last 1 year, about 30 resident doctors have been assaulted in different hospitals in Nigeria. Of the 30 resident doctors, I can tell you there's another 20 nurses and other healthcare service providers within Nigerian tertiary hospitals. And based on the statistics we have at the Secretariat of the Nigerian Association of Resident Doctors, perhaps 7 or 8 of those cases have been, where the assailants have been arrested, have been taken to court and charged for the crime they committed. It's increasingly becoming a realistic fear that you could be assaulted, you go into the emergency, see patients, and then before you know it, you're getting assaulted.
Who are these people? Are the family of the patients or the patients themselves, or what?
All of the above.
On what basis do they assault doctors?
You see, there's something called clinical governance. We have a lot of challenges within the healthcare sector. You can't really pinpoint one item and say, this is it. Sometimes it could be power failure, and you needed to go to theater, there's no power, you won't be able to power those machines to be able to operate on that patient.
But the federal government says most of the hospitals are now on some independent power and support. I mean, the federal government has mounted a lot of infrastructure reforms.
The report from our members and leaders across 100 centers in Nigeria, both state and federal government, tells us that power is still a challenge. I mean...
has there been an improvement in infrastructure within the health sector in Nigeria in the last 3 years?
Over how long? Why are you choosing 3 years?
No, because I mean, I'm judging, because we can only hold accountable. Just a moment, sir. We can only hold accountable the government that is in power, and that's what I'm asking over the last 3 years. They said they've done quite a lot. But you are a practitioner. You are not. You didn't just arrive in Nigeria and that's why I'm asking you. Over the last 3 years.
You know why I'm smiling, Sean?
Yeah.
I'm smiling because I'm a young practitioner. I've practiced for 16 years. And it doesn't satisfy any clinical significance if we create a window of 3 years to answer this question. As far as I am concerned, from the time I started practicing till date, there has been some marginal improvements. Is it where we need to go to? No. Can we do better? Absolutely. What is my concern? Apart from this assault, I have house officers. These are the youngest of the profession, who about 104 of them have 3 to 5 months arrears. About 25 of them have 9 months arrears shown. They have been working for 9 months and they don't get their salaries. Of the ones that actually do get their salaries, shown they get their salary, for instance, January salary, they get it by the 3rd or last week of February. In this country, people who work for the entire month.
This is what goes on right now.
Right now, and they have to wait for the end of the next month to get the salary of the previous month. I mean, the National Executive Council is not worried about what the statistics is in the last 3 years. As far as they are concerned, there are house officers who are not getting their pay as at when due. There are those of them who have arrears, over 130 of them that have arrears. In fact, at the last count, someone told us that of the 130, only 7 or 11 will get their arrears. The rest will have to wait until the end of their housemanship. How is that tenable? And then we have cases of assaults. And then in Luth, for instance, Lagos University Hospital, where currently the seat of power in Nigeria sits, we have a management that is making it look as if doctors are beggars of call meal. For 7 years, they have not provided call meals. Now they are telling us there's no circular.
Explain to laymen what that means.
So when you're on call, it's a requirement that you must be available. And I've explained calls in previous encounters we've had. Call is when from a close of work from 4 in the evening till 8 the next morning. If it's a weekend, from 8 in the morning till Monday morning by 8. You're expected to be at your duty post. And in that duty post, you're expected to be vigilant, active, take care of cases, stabilize, refer, manage as the case may be. Now, you're human. You would require basic human functions. Relieve yourself, pray, rest, and eat. And then 20, 30, 40, 50 years ago in this country, wise men thought of it that to keep the doctor active within the hospital and other healthcare workers, give him a meal, 1 meal per 8 hours or per 12 hours, so that he doesn't have to leave the hospital.
The duty post.
7 years ago, some wise men in Luth decided it is time for that to stop. For some reason, they were able to extract it. And now we're beginning to have issues. For instance, Luth will tell you its IGR is shrinking. Who is the chief primary driver of that IGR? Is the resident doctor. Because he will see the patient, there's consultation. He will request investigations, it is being paid for. He will request a CT scan, an X-ray, an ultrasound scan, a chest X-ray, multiple. He will prescribe medications, he will admit, he will send to theater. Hospital raises revenue. In addition, that resident doctor is the primary reason why morbidity and mortality is coming down. And then the tradition that has trained the current managers of Luth, providing call meal. You know, they now say, no, we provide free call meal only on Salah and Christmas and public holidays, as if doctors are beggars of food. What we're telling them is no problem. You can keep your meal ticket. You can keep the call meals. What we will do, at the beginning of the call, our members will take 2, 3, 4 hours, go home, cook, eat, get ready, and come for the call. Nobody will complain if that happens. So you see, Shaun, the National Executive Council of NAD is not really interested about statistics of last 3 years. These are things that have been happening. I just quoted 7 years to you, twice, on different matters.
You gave them 10 days. Do you think they can realistically meet those? Because what is imminent, 22% of doctors registered with the MDCN are resident doctors. It means something. That when 22% of the entire workforce of Nigeria healthcare system, or the doctors in Nigeria registered, are down to, there is a disaster waiting to happen in the healthcare system. Is 10 days sufficient for the federal government and the Minister of Health to be able to answer to this call?
Absolutely. Absolutely. And let's be practical about the solutions. You mentioned 22% of doctors in Nigeria, according to the MDCN register. That figure was probably 45 or 50% 15 years ago. How do you keep a doctor in this country when a house officer doesn't get his January salary until the end of February, or a house officer works for 9 months without salary, they will all leave. Or you're telling a senior resident who is in O&G, who sleeps over in the labor room, who probably will conduct 2-3 CSs overnight, that you cannot provide call meal because it is not covered by a federal government circular. How do you expect that doctor to stay? That is why the numbers are dwindling. Secondly, we're talking about assault. How long does it take to apprehend an assailant? There are CCTV cameras that have captured them. What is difficult in apprehending someone who has committed a crime by assaulting an officer of the civil service? As simple as that. What is difficult in the office of the Accountant General, or the Ministry of Finance, or the MDCN, coming out with clear guidelines or platforms that will ensure when the NAD president gets his salary, or Mr. President of the country gets his salary, the house officer also gets his salary. Now, these are issues that will be giving this bureaucratic bottleneck problem a big brouhaha. But in a real sense, these are policy changes that can be effected. I mean, coppers get their salaries as at when due. Corps members. I mean, it's not any snide on corps members, but house officers are equally important. They are serving the nation. Can't we put the house officers on the same platform that pays corps members? You know, so when you look at it, when you look at the challenges, for instance, Sheun, let me add one thing. There's something called collective bargaining. Collective bargaining agreement. This is a mechanism via which the federal government reviews salaries of its employees. Last year, around June, we were told, come and do CBA for 3 months. We hope to round it up in 3 months. Sheun, as I'm talking to you today, we don't know when that CBA is going to be concluded. No one knows when the next meeting of that CBA will hold. These are challenges that breed despair. We still have excess workload. We still have burnout.
It worries me because there are those, we have about 55,000 registered medical doctors.
I don't think we have 55,000 doctors practicing in Nigeria. I may be wrong.
Registered.
Well, yes,
registered. So, and in that number alone in one country, the UK alone, account for 4,600 or more doctors that have left Nigeria in 3 years, from 2023 to 2026. And we have not that UK is not the leading country, or maybe it's one of the leading countries that have received more Nigerian doctors, trained doctors. You have in the Gulf countries, you have Canada, you have in the United States. And in all of these countries, we have higher number or almost equal numbers that have gone into the UK. The UK has the statistics which shows about almost 4,700 trained Nigerian doctors. And you know how much it takes to train a Nigerian doctor. Out of the 55,000 that we said we have on the register, there are possibility because of this condition that we might lose more. What would you say the government should do immediately? Because here they are dwindling situation as status in the Nigerian health sector, but the doctors are angry, and the same thing that we are seeing is a disappointing situation that we find ourselves. You are a senior medical practitioner in this country. What is the way out? An average Nigerian that is watching you, you have painted something that looks like a bleak scenario in the healthcare sector in Nigeria. What is the way forward?
Well, the resultant effect of what you're talking about means today, ask hospitals, in fact, ask the federal government. They put out adverts for interviews to employ resident doctors. Nobody goes. The numbers have dwindled. You go for exams. 10 years ago, when you call for exams, 300, 500 people per department or faculty will apply across the country, each subspecialty. Today, there are specialties that will have 2, 1, some will have none that will apply for postgraduate exams, which means doctors are running away from training. The federal government better look at that. 1. 2, the collective bargaining is, I mean, the last time salaries were reviewed in the health sector was 2012 or 2013. The collective bargaining is a signal for hope that needs to be concluded. You are now tolerating assault. You're tolerating house officers' delays in salaries, the youngest of the profession. Those being assaulted are not senior colleagues, except for the case that EFCC went to Uyo and assaulted a professor. Or a larger majority of those cases are young doctors. That counts in their.
So it is no retreat, no surrender.
That we bring these things forward to the federal government to put their eye on means we want it solved. You don't solve it, you encourage people to.
So it is no retreat, no surrender for NAD.
Absolutely.
Is that how they fix it?
Absolutely. In fact, the National Executive Council made it very clear that, Mr. President, you have asked us to postpone this ultimatum 1 too many times, 4 times in 7 months, and you still have these challenges lingering.
All right. Dr. Suleiman, thank you so much, and I wish you
Thank you
and
for
your
having
colleagues the very best. I'm hoping that the federal government will do something, and urgently too. Thank you so much indeed.
Thank you for
When 22% of your working population in the healthcare medical practice, the doctors are saying they will down to, you better do something before it's too late. That's our show for tonight, everyone. Many thanks for watching. I'm Sean Wakimale. God bless Nigeria.